why you have started DMHCA.
Directors actually started this particular company or the organization to help these healthcare professionals, those who challenge in their daily practice.
Which kind of courses do you provide?
Fellowship and post-graduation diploma and certification course.
How do these courses or programs are helping doctors?
So let's say, for example, the fellowship course or PG diploma course definitely help a doctor to enhance their knowledge and increase their confidence in their daily practice.
Are these courses shortcut to a growth or something?
So I can't say it's a shortcut, but if you compare with the MD or MS degree, obviously it's a shorter duration.
DMHCA have tie-up with so many hospital or clinics. So could you please just name few if
Now
you can?
We have Medicover Hospital, Andhra also Medicover, and if you go to Bangalore, still we have Medicover Hospital, and Delhi we have Sarvodaya Hospital, and many more.
What are your popular courses?
In Delhi Medical Healthcare Academy, usually a lot of people choose diabetes, emergency medicine, critical care medicine, and gynecology as well, cardiology. So there are a lot of actually.
So do you have any inspiring story of any doctor?
There is a doctor from Kerala actually.
So is it practical to wait 8 to 9 years after MBBS for MD or MS? So how are these courses different from MD or MS? How does a doctor choose which course is right for them? Do these courses really lead to a better opportunity for doctors?
We are not restricted to India, we are representing on global level.
Hello everyone, welcome to Mentor Talks by DMHCA, the podcast where we keep things real, simple and helpful for doctors who is figuring out their next move. If you are an MBBS doctor, a fresh graduate or even just a postgraduate person, or you are confused about what to do next, then this episode is completely for you. Today we are asking big questions like what should a doctor do after MBBS and why. We will also talk about jobs, salaries, healthcare trends and yes, some no filter questions and candid chit-chat about DMHCA itself. No jargon, just real answers. And today we are finally joined by two of DMHCA's most experienced professionals, Mr. Nikhil and Mr. Moin, senior advisors for medical career and education strategy, with over 10 years of experience in the industry and help thousands of doctors shape their postgraduate journey through fellowship, diploma and clinical training. So hello.
Hi.
Hello.
How are you?
Yeah, I'm good. How are you?
I'm good too. So how are you feeling today? Like how's life treating you so far?
Yeah, everything is good. What about you?
I'm good too.
Going fine. So this is the like we got an opportunity to express and explain about the DMHCA here. So I really thankful.
Okay, so are you excited to represent DMHCA itself?
Obviously.
Okay, so first thing first, I would ask you what exactly is DMHCA and what does it do?
So DMHCA, Delhi Medical Healthcare Academy, is Asia's largest healthcare education provider. We provide quality healthcare education to MBBS doctors, those who have completed the MBBS, and some postgraduate doctors like specialist doctors as well. So we help them, to enhance their career, by providing our online and offline training.
Okay, so would you like to add something?
Yeah, definitely. Like basically our aim is to provide quality education not even in India, at global level.
Okay.
Just our vision is to provide quality education across the globe.
Okay, so since we are talking about DMHCA, I would definitely ask why you have started DMHCA. Like, what was the vision? Like, is there any problem you are solving for doctors?
Yeah, the main motto and vision of this particular Delhi Medical Healthcare Academy, our directors actually started this, particular company or the organization to help these healthcare professionals, those who challenge in their daily practice, so in their career. So we are here to, give proper guidance in any particular path of their career while they're practicing. So the main motto is to provide healthcare, education to healthcare professionals. So this is the main motto, and so our director started this particular Delhi Medical Healthcare Academy in 2018. It started in New Delhi. So then we have expanded, our office. We have a branch in Hyderabad, and now we are having in J&K Kashmir, in Srinagar as well.
Okay, so basically DMHCA is helping doctors to basically enhance their skill.
Yeah, it is. I mean, if you are in any particular careers, not only healthcare professional, but I can say any profession. So upskilling their knowledge, upgrading their knowledge to stand out in the competition or to go ahead in the competition. Upskilling knowledge is very much important. So in that process, Delhi Medical Healthcare Academy, started this particular education institute to help the doctors.
Okay, so could you please tell us, our audience, which kind of courses do you provide?
See, we have a very, very wide range of courses. Okay, like for example, we provide fellowship and post-graduation diploma and certification courses.
Okay.
So these courses helps doctors to gain proper and sufficient knowledge and advanced skills through online material and through practical training also, right? So these courses, after completing that, if they are adding these additional qualifications, right, they'll be considered as a trained doctor. So we have a wide range of courses. We are the only one presently offering courses in the branch of medicine and in the branch of surgery also.
Okay, so as Moin has already mentioned all the courses DMHCA is providing right now, so could you please differentiate all the courses?
See, we have three different categories, as Moin said. We have certification courses, fellowship courses, and PG diploma courses. So let's talk about certification course. These are very short courses actually. So those who want to complete like a crash course,
Okay.
within 6 months duration. So we provide them the certificate course. Otherwise, if they want to learn a vast subject, with the training, proper training, not only online. So we provide fellowship and PG diploma. So the main differentiation, if I can say, especially the duration and the content that we cover in that particular duration, would like to have deeper knowledge in any particular specialization or super specialization. So we suggest them fellowship and PG diploma courses. And if someone wants to learn basics or to just brush up their knowledge, we suggest them the certificate courses. This is the main difference I can say.
Okay,
And
so
apart from this, apart from categories, as Moin said, yes, we have a wide range of specialties that we cover. So non-surgical and surgical departments we have. We also have specialities, and we have also have a super specialty to help them MD, MS doctors as well.
okay, so if I conclude your answer, so that would be, if someone want to just brush up on their skills or want to have some kind of knowledge on specific field, they can go for certificate course. And if they want to do some practical things and some deep insights about that particular specialized
Exactly.
course, they can go for PG diploma and fellowship, right?
Yes.
Okay.
As DMSCA, we suggest the doctor according to his or her profile, okay, what course is suitable to him or her. So because in case like if an MBBS doctor practicing since 4-5 years, so still he'll be considered as a general physician because
Yeah.
he's not getting into post graduation and he's not becoming a specialist, right? So according to this, we'll just find out the doctor's interest or the area of practice where doctor is practicing. According to that, we suggest a relevant course to him which can enhance his career.
Okay, so would you like to add something?
Yeah. If you want me to answer how to suggest, so usually it's not like I can't directly suggest a particular doctor course because there are a lot of specialities, right? So first of all, I would like to I will understand doctor's interest and the profile and the area of interest they are having, because any MBBS doctor, while they're pursuing their medical schooling in those 4-5 years of study, so definitely few people will be interested in any particular subject or a specialty. Someone will like aesthetics and skin, someone will like ortho related, something like that. So people, those who complete their MBBS, so immediately few people go for PG NEET and few people practice. So here I can differentiate, like those who are directly want to go to PG, definitely whatever the subject that they liked in MBBS, they attempt for that particular PG seat only. Otherwise, people, those who are practicing for years, like 4 or 5 years, so whatever the difficulties they are, handling or facing in their daily life. So there is an example, if I can say, MBBS fresh graduate and directly appearing for NEET PG with interest of cardiology, if they're unable to, crack it, definitely I can suggest for cardiology directly, because they're already having the desire on cardiology. Otherwise, in another scenario, there is a doctor tried multiple times but couldn't qualify,
Yeah.
practicing since years. So I would ask him what kind of practice he is doing, whether he is working in a corporate hospital, whether he is working in his own clinic. So I would ask him what are the challenges that he's facing, right? So if few people face challenges treating kids or cardiac cases or hormonal diseases. So in that way, I would suggest them, if they are, the particular clinic is experiencing a lot of kids, no, definitely I will suggest pediatrics course, something like that. So here I can't directly suggest, but we need to understand doctor's profile as well as area of interest.
Okay.
So that helps them, to suggest a course actually.
How do these courses or programs are helping doctors?
See, as I told you earlier, so whatever the gap they are having in their career or the challenges they are having in their career, our course, let's say for example, the fellowship course or PG diploma course, definitely help a doctor to enhance their knowledge and increase their confidence in their daily practice. Because we have designed this particular, a fellowship or PG diploma by expert faculty. Okay, so the working professionals no need to go anywhere, so they no need to leave their practice. So we almost cover 9 months to 10 months of the syllabus in online itself, so that the remaining 2 to 3 months they can come to hospital and they can experience the patients there under supervision of HOD there. So in this manner, they are going to cover the theory part as well as the practical training part, so that whatever the challenges that they are facing, no, so they will cover the theory part to brush up their knowledge, as well as they will see the patient in the hospital under the supervision, so that they will have a proper hands-on experience as well. So this will help them to enhance their skills while they are practicing in the daily practice. So in this way, so definitely our courses will help them in their daily routine.
Okay, so since we are talking about courses, career, and everything, now let's be real. Like, so do these courses really lead to a better opportunity for doctors?
Yeah, as you still the point comes there only, like the MBBS doctors, right, after completing their graduation they'll be practicing, right? So mostly they'll be managing specifically outpatient or any other department or branch, right? So now, like the next option what they are having is to crack PG NEET and get into specialization and choose any specialization and complete that post graduation and become a specialist. Then their career will boost up.
Yeah.
Right. So till as they carry the same MBBS qualification, they'll be considered as a general physician only, right? Now, for an example, if any doctor, two doctors are there, both are MBBS doctors, both are having 5 to 6 years of experience, and they are practicing. And if they approach to any hospital for a job opening, right? One doctor, if a doctor has done any fellowship or diploma from DMHCA, so that he'll be considered as a trained doctor. If they both are approaching to hospital, obviously the doctor who carry the additional qualification will be getting an opportunity to work under the particular specialist or super specialist, right? So in that way, definitely they can take their career one step ahead, until unless like if in case like if they are not cracking the PG NEET or getting into the post graduation, till then they can add this and they can boost their career, they can take their career ahead.
So even the another day I was also searching for eligibility criteria for PG NEET. I think they have added some another thing that you have to have some kind of internship also for 1 year.
1 year.
So rather than I'm not saying like they should not start with PG NEET or they shouldn't try for PG NEET, but I think if they do that PG NEET, they can do your courses as well, like side by side.
See, yeah, so here actually the advantage of taking our course, a person should be in MBBS with a degree and a registration number, that's it. So no need to attempt any PG NEET, or we don't ask for PG NEET score to join our course.
Okay.
So there is no entrance exam as well to join in
Okay.
DMHCA to fellowship or PG diploma. So it's very easy. The person should have MBBS degree and medical registration. That's it. So in that manner, so they can start fellowship program or a PG diploma program, and side by they can prepare for NEET PG entrance examination.
Okay, so like, are these programs recognized by medical boards?
See, NMC is the Medical Board of India, right? National Medical Commission. So NMC will not recognize these kind of programs offering by a private institution, right? NMC will recognize only formal degrees like MBBS, MD, and diplomas, DNB, right? But still, it is well encouraged by NMC because these are additional qualifications. As I said that doctors are not having many options after completion of MBBS, right? Straight away they need to get into post graduation. So meanwhile they can do these fellowship programs and they can choose as per their wish, as per their interest. They can choose any fellowship of that particular branch and they can add it and they can practice also.
Okay.
Right.
So
not even it gives an opportunity to MBBS only. Our programs are designed for postgraduate doctors also. Okay, the doctor who is a specialist, for an example, MD pediatrics, right? Doctor is a specialist and he's practicing in MD pediatrics. So now, like, he want to gain more knowledge, advanced in-depth knowledge about subspecialty. For example, want to gain knowledge about pediatric echocardiography or pediatric endocrinology, right? So these kind of programs also we also offer these kind of programs, subspecialty programs for even for postgraduate doctors also.
So which means MBBS graduates and even experienced doctors
Experienced
both can
doctors.
join your course. Okay. So what kind of doctors typically enroll at DMHCA?
We have given eligibility criteria to, it starts from MBBS above doctors can enroll. Apart from that, we also give eligibility to Ayush doctors, right?
Okay.
Because mostly what happened, like the MBBS and above doctors, they are practicing into metropolitan cities, tier 1 cities and all that, right? So most of the area, the districts, the villages and all that, where there is a huge requirement for the doctors, right? So in that area, the Ayush doctors are contributing to the society, right? So even we are offering courses to given some, for few courses we have given eligibility to Ayush doctors also.
Okay.
So they should have that kind of basic knowledge about modern medicine. So in case of any emergency, they can handle that kind of cases also, right? So basic eligibility criteria we have given to Ayush doctors.
So since we have talked a lot about your courses, so are these courses a shortcut to a growth or something?
Actually, in my point of view, there is no shortcut if you want to grow.
Yeah.
But so I can't say it's a shortcut. But if you compare with the MD or MS degree, obviously it's a shorter duration, because MD, MS degree, you need to prepare for NEET PG, you need to crack that, and you need to do a 3 years degree, right? It's a long process, obviously. But if someone is unable to couldn't qualify, they can do this course. So I can't term it as a shortcut, but it's another option, actually, extra added advantage someone can choose, actually.
Okay. So like in your courses or classes, doctors will get hands-on training as well, or like just it's a theoretical part only?
See, as I mentioned earlier, we have various programs, like, let's say, for example, certification courses, the short courses, those are completely online. But if someone would like to gain a proper practical training and hands-on training, we have both fellowship and PG diploma programs where doctor can choose full 1 year clinical training in hospital as well. Because Delhi Medical Healthcare Academy having a tie-up with a very large number of hospitals across India, even globally, because we have global audiences as well, not only India. So we get inquiries and applications from global doctors, actually. So we have tie up with well-known hospitals. So where where we provide this particular training under the supervision of a specialist or a super specialist.
Okay, so since you have mentioned like DMHCA have tie up with so many hospital or clinics, so could you please just name few if you can?
Yeah, basically, we got tie-up with all top-notch corporate hospitals in different locations, different parts of the country to facilitate our students, right? So almost like pan-India, we are having tie-up with different hospitals. Like in Telangana, we have a Medicover hospital. Andhra also Medicover, and if you go to Bangalore, still we have a Medicover hospital, and Delhi we have Sarvodaya Hospital, Sama Hospital, and many more across country we have. So our aim is to provide quality training, okay, in the hospital to our students, those who are joining our different courses according to their interest, right? So we almost what we do, like we always take care about their convenience also, right? So according to students' location, we suggest student to go and take the training into that particular hospital, right? So location wise, we suggest students. So it is very, very convenient for students, and we provide a lot of flexibility to the students to study these programs, right? In terms of the online part and in terms of the practical training. So lot of convenience is there, because the concept itself came for the working and busy practitioners, right? Because they are not having time to go for regular classes, going sitting in a classroom base, right, leaving their practice or clinic, so they cannot do that. So
They
that's
don't
the
have
reason
that
the
much time.
concept came up, and now we are giving three types of options to the student. One is like completely online. Second option is like blended learning, like online plus offline, and completely offline also. So it again depends on the student's requirement and the scenario or the interest of the student. We suggest courses and the location also to provide the quality training.
Since you have mentioned that you have clinics in many cities, but suppose if there's a doctor who is not from India or who is not from these cities, like will they be able to join your course? If yes, then how?
Definitely. Basically, like we are not restricted to India. We are representing on global level, right? We have so many students across globe, in the Middle East, in the African continent, right? So generally, they take blended learning courses. Online part they complete from their country, from their place, and they will come down to India to attend the practical training. And even though recently we got tie-up in United States also, nearly 70 hospitals we got tie-up. So if any doctor is interested to go and take training in USA, so we also provide training over there.
Wow, that's great. So Nikhil, would you like to add something to this?
So as you asked, these particular doctors should be from these cities only. Right? So, so we have a tie-up. We had a tie-up with so many doctors in metropolitan cities, especially. See, a doctor can do this particular clinical training in our hospitals, even though they are not from these cities, because it's if someone would like to get more practice, why we have a tie-up in these metropolitan cities, because of the footfall they get. Let's say, for example, there is a doctor, he's asking his clinical training in a small town. We can provide, that's not a big deal. But the thing is, the footfall is low. But if I suggest him a Delhi, Mumbai, Hyderabad, like hospitals like Medicover, Kim's Hospital, these particular hospital will have a lot of footfall in that particular specialty. So it's not about the location. It's always about the hospital and the footfall they get, because we concentrate on the exposure that they get. It's not about the location actually, because if someone would like to really want to gain hands-on practice, I would always suggest them to travel to the metropolitan city so that they can get more footfall. And if they spend three months or 6 months or 12 months of time in a particular hospital under a super specialist, you just imagine the exposure that they are going to get.
Okay, so basically DMHCA is trying to give quality, right? Okay,
including theory as well as
hands-on training. Yeah, it's very rare, I feel. So could you please tell our audience how many courses do you have?
Basically, we are offering more than 200 plus courses.
That's a huge number.
And as I said that, and in the branch of medicine and the branch of surgery also. So we have very so many we have flagship courses, you can say hero courses.
Okay. So as you have mentioned, you have more than 200 courses, which is a huge number. So
Okay.
may I know like what are your popular courses?
See, popular courses, I can say, like in Delhi Medical Healthcare Academy, usually a lot of people choose diabetes, emergency medicine, critical care medicine, and gynecology as well, cardiology. So there are a lot of actually. So I can say after like post MBBS, these are the courses actually chosen by most of the doctors actually. Yeah.
Okay. So I'm sure most of the doctors are watching this episode. So I would like to know like what's the journey of a student or a doctor, like from application to certificate, like how they can apply and how will they get their certificate, basically everything from start to end.
Okay. So as you were talking about the journey of a student actually from the application to certification, right? So we have different teams actually, those who handle in these particular segments in the journey of a student with Delhi Medical Healthcare Academy, right? So usually doctor apply, they can apply from website directly, or they can call us, where our dedicated team of admission counselors will help them how to apply. Once we receive the application form, so they need to do some documentation process and the fee payment process. Once it's done, so there is a dedicated team who can inform us where they can watch our content, like online content, and there is a dedicated team sitting there. They will help them how to write the examination and when is their clinical training if they choose that. Okay, and they will send them to the hospital and they introduce the HOD there in the hospital to get the training there. And then we also help how to write the examination, what are the assessment, we help them, as well as once they complete that, we provide a certification from the accreditation bodies that we have, like in International Board of Medical Practitioners, and we have UGC approved universities as well. So in short term, so the journey would be like from application, then access the content, read, and then if you want to take training, take the clinical training, then write the examination, take certificate. That's it. It's very simple
Very
process
easy, yeah.
for any doctor, or especially for working professionals. Without wasting much time, they can enhance their knowledge.
Throughout the course, different teams guides the doctor, so it is easy.
I'm sure that so many doctors have been already completed their certificate program for DMHCA. So do you have any inspiring story of any doctor or anything you would like to share to our audience?
So as you asked about the stories, actually, even I have helped a lot of doctors to fill their career gap actually. So I got like few interesting stories actually. So there is a doctor from Kerala actually, I don't want to take name, but there is a doctor from Kerala actually. He would like to do a diabetes course first. So he literally completed that within a year, and in the 8th month of 7th month itself, he introduced 2 of his friends, to do the same course, and he introduced again another 2 friends to do a different course, and just in the span of 3 years, they have started a polyclinic, and they are successfully running it in Kerala.
Wow.
So see, this is just one story, but there are a lot of stories like this.
Okay, that's great. So what skills do they learn during these courses?
See,
what kind of skills they can expect from DMHCA?
See, as I mentioned earlier, again, it is all about what kind of requirement that you have, because we are into both, like only online to brush up your knowledge, and we have both, like if someone would like to gain some theoretical knowledge and just want to explore some little duration to look at the patients. And there are few set of doctors who want to only get proper training, right? So they can expect all these things actually, because based on their requirement, so we can provide online, both online and offline, as well as proper hands-on training under a supervision.
So are these courses internationally recognized?
See, recognition in the sense, I can say, as we are already having students globally, yes, people from outside India, especially our neighboring countries and South Asian countries, as well as Middle East and some African countries. So we have a very huge number of doctors we have as a student base from these countries. Yes, if someone would like to practice in their particular country, that particular country person will have their own license to practice in their country. So definitely they're already allowed to practice there. But if they have any particular gap, or if they want to enhance their skills in any particular subject, definitely this fellowship program will help them to upskill themselves in their daily routine, like if they are having any clinic, or they can go to any corporate hospital, right, any country, or like any Indian doctor, let's say, as you mentioned, international recognition
Yeah.
part. So any Indian doctor would like to go to abroad, so definitely that particular country's license exam will be there, like as we
course.
have our MCA registration, or medical council registration. In the same way, if you want to go to any particular country, first of all doctors know that they need to clear that particular license examination. Let's say if someone would like to go to US, they need to write USMLE, they need to crack it. And if someone would like to work in UK, so they need to crack this MRCP, and they need to get PLAB, they need to write PLAB, and they need to get GMC registration. So that part is basic thing. But after that, they will get the license to practice there. After that, this particular fellowship courses definitely gets recognition to add as an extra qualification to their current profile.
Okay, so which means your courses will help doctors who's planning to work in abroad.
Obviously, we will help, not we can't give authorization, but definitely we will help them to work in any particular country, because such kind of standards we are providing in our content.
See, it gives an opportunity to basically practice into that particular branch. So, because we have very strong accreditations available with us, as like IBMP. We got accreditation from IBMP, International Board of Medical Practitioners, right? So our courses, our certifications will definitely add value to the doctor's career, doctor's profile, right? Our certifications has basically global recognition, okay, as an upskilling programs.
Okay, so let's talk something real now. So will these courses will rise their salary or income?
Definitely, it will increase the earnings of a doctor. Why? Because I'll give you an example, right? For an example, an MBBS doctor practicing since 5 years in a reputed hospital, right, with a pay scale of XYZ amount, right? And he wants to get into some other department, or want to boost his career, or want to join some other hospital, right? So if he's adding these kind of fellowships, completing and adding these kind of fellowships, so as I told you, like he'll be gaining sufficient knowledge and a clinical exposure
Yeah.
in that course, right? So once he moved to another hospital and joining there, getting a new job, obviously there would be a hike of 25-30%
Of
in his pay
course.
scale, definitely. So in that way, like, because every specialist, super specialist, or the HOD will prefer to work with a trained doctor instead of working with a normal
Normal, yeah.
I mean to say, like MBBS who carries experience only, not adding any fellowship. So there is a preference that adding fellowship, definitely these doctors will, the HOD will prefer to work with them. So they are having better opportunities.
Okay, so are hospital hirings doctor with these courses qualification?
Yeah, see, actually, see here, actually, as you asked, like, will there be any salary
Yeah,
hike,
like-
or they can increase their salary, or get a hike, or promotion, or something like that.
True.
So if you want me to simplify it, so usually if there is a MD doctor, gynecologist, let's say for example, if there is any gynecology doctor, so if she is having a proper setup of gynecology clinic, she will be having good footfall there. So to handle such a footfall, she is to have a proper OPD section as well, to treat the particular patients. So that particular gynecologist will expect an MBBS doctor with the proper knowledge in gynecology, right? So there is a doctor who is trying to become a gynecologist, couldn't crack NEET PG. So this particular doctor can gain knowledge with our fellowship program in DMHCA, and can work in that particular gynecology clinic with a specialist there.
Okay.
Because a gynecologist won't hire another gynecologist under her, right?
True.
So in this way, these MBBS doctors, those who are unable to crack NEET PG, so they can gain in their desired subject and work in the department. In this way, they will get career satisfaction, because they are going to work in their desired subject, as well as, so as you are not going to work as a normal physician there, definitely you are going to work in a gynecology center, So definitely you'll be expecting some more salary, and that gynecology will obviously pay you.
Okay, so which means doctors and hospitals are considering these courses, right?
Yes, exactly.
Okay, so why should a doctor consider DMHCA courses instead of PG NEET?
Okay. See, we never say not to write NEET PG, first of all, right? I can't say don't choose NEET PG, choose Delhi Medical Healthcare Academy program. I can't say this because any MBBS doctor's ultimate goal is to become a specialist first,
Yeah.
right? To become a specialist, they write NEET PG. I can't say choose between us, but yes, we will be helping you if you're unable to crack. Or I have seen a lot of examples as well. The people, those who crack NEET PG and studying their MD degree, also pursuing our courses for extra knowledge. So here, I can't say them choose between NEET PG and our courses, but choose our course for sure to have extra knowledge as well as added advantage on your profile.
Then I would like to add, basically, PG NEET, as you said that why they should choose DMHCA. See, we are supporting the doctors, so it's a kind of backup for them, right? We are not asking them to leave a PG NEET, do not attempt PG NEET, just enroll for the DMHCA courses. It's not like that, right? Those who are preparing for PG NEET, our courses will help them. Those who did not qualify for PG NEET, our courses will help them, right? So in all the way, in all the aspects, our courses are supporting doctors, helping doctors, right? In terms of gaining additional knowledge, clinical exposure, right? If they are not qualifying PG NEET, they can enroll our course, complete our course, and they can practice into that specific branch as per their wish, right? So in that way, basically, it's not like that we are telling them do not attempt PG NEET, enroll our courses. Our courses all the time, our courses are available to support doctors.
Support
right?
doctors.
So in any movement, according to their requirement, they can enroll our courses and enhance their career. Right? They can take their career to next level.
So, which means you are helping doctors, right?
Yeah, exactly.
And students also who are studying. So, since we are talking about NEET PG, so is taking a gap year for NEET PG, like, is it worth it?
Definitely. See, if no doctor is attempting PG NEET, right? And after a few months, couple of months, they will get result, right? And again, they will wait for the counseling, right? First phase counseling, second phase counseling, third phase counseling. So almost it will take to get clarity whether they are getting the seat or not. It will take almost 4 to 5 months, right? So same time, if doctor is enrolling our course, once he attempt the PG NEET, he can complete our course because that kind of options we are giving, that kind of flexibility we are giving to doctors to study our course, right? So even though if they are cracking the PG NEET and getting seat in post graduation, they can complete our course. God forbid if any doctor is not cracking NEET and not getting seat, he can complete this course and he can start practicing into that branch, right? So in that way, it's a kind of backup for the doctors, right? So they can almost like I'm just strongly suggesting, they can create a backup. They can enroll over courses, even though if they are preparing for PG NEET.
Is it practical to wait 8 to 9 years after MBBS for MD or MS?
No, 8 to 9 years practical to wait. Means, see, after completion of graduation, directly they can attempt the PG NEET. It's not like that to wait. But after completion of graduation, MBBS, generally what doctors do, some doctors join start their clinic own practice. Some doctors join any corporate hospital, right, practicing over there, and simultaneously they are preparing for PG NEET and attempting PG NEET, right? So basically, it's not like that. Very next year also, the doctor can attempt PG NEET, right? We are having option to attempt PG NEET.
Obviously, so there is no MBBS doctor who will wait for 8 years
8
to write
years.
NEET PG, to be honest.
Very next year they attempt
So,
PG NEET.
as I told you, their main goal after becoming MBBS, these days, no doctor will just be
Very next year they
sitting
attempt PG NEET.
for 1 year also. The very next year, they attempt NEET PG to become a specialist.
Okay, so since we are talking about DMHCS courses, so I would like to ask, like, are these programs a smart alternative or a full replacement of PG NEET or maybe MD or
No,
MS?
you cannot say it's a full replacement, right? It's it's a second option for the doctors, or you can say an alternative also, that you can say, because obviously, like after graduation, the post graduation is an important formal degrees are there, right, which is designed and offering by the regulatory bodies, right? So that is very important. But again, as I told you, like even though if they are getting into post graduation, they can enroll over courses and enhance their knowledge, and they can utilize it for their practice. Or the doctors, those who are not getting into post graduation, it's a good opportunity for doctors to enroll over courses and enhance their career. So one more thing I would like to clarify here, that we are not only offering courses for MBBS, these courses are for postgraduate doctors also, as I said, MD and MS also, because we are offering courses in the branch of surgery also. So we are having few courses available, like general surgery, robotic surgery, right? So many courses are there. So same like that, we are trying to support or help MBBS as well as and above doctors also, specialists and super specialists also. Few courses we are offering for the super specialist doctors, like interventional cardiology or interventional radiology. These courses are for super specialist doctors or specialist doctors.
Okay, so would you like to add something?
So actually, we can't call any knowledge enhancement program as a replacement for a regular degree.
Yeah.
You can't even compare, because cracking an entrance examination and getting a seat with a computation of 1:4 ratio and studying for 3 years, definitely different from a 1-year course with some theoretical knowledge and clinical practice. But yes, these are alternatives, those who are unable to get their specialization seat. So this won't replace PG NEET, I would not say that, but yes, these particular courses are definitely an alternative choice for any doctor to get into any specialization, or a specialist doctor to get into any super specialty.
Okay, so we have talked a lot about DMHCA courses. Now let's talk about DMHCA itself. So where do you see DMHCA after 5 years?
See, as the pace that we are having now, because DMHCA started in 2018. We tried to understand the market for a few years actually. We limited ourselves to India only in the initial years, but later we recognized the requirement of the doctors globally to enhance their knowledge. So we started expanding. Last year we started in branch in Delhi, in Hyderabad. Later, immediately we started in Kashmir as well. With the pace that we are expanding, so we are even planning to start a branch in Dubai by next year. So in that pace, if you ask about 5 years, no?
After 5 years, we should see DMHCA should have presence across globe in every country, right?
Yeah.
This is 1.5 lakh students. It's about India, but our aim is to reach and provide quality education every part of the world. So that is our main.
To be honest, there is a lot of need for doctors.
Yeah.
So we are here to show them the path.
That's what we are just planning to open another branch in Dubai. Very soon we'll do that.
So we would like to directly help the Middle East doctors there by,
to help
that's the main goal.
In the Middle East. And then we'll plan for the next in Europe or any other continent.
So is there any new program we can expect from DMHCA in future?
We do have so many programs in pipeline, basically in queue, and the content team is working on it, and we are waiting for few approvals. So very soon we'll just introduce few more courses, very interesting courses in the branch of surgery also, and in the branch of medicine. And we are the only one who's offering wide range of courses, and the doctor is having we are giving a tailor-made solutions to doctors. So they are having a very good, they can complete these courses with their convenience.
Okay. So as you have mentioned so many times that you guys have online, offline and blended course. So why would someone prefer a blended course?
See, it depends on the doctor's requirement, because few doctors, they are already experienced doctor. They just want to again refresh themselves. So they go for the online part. Okay, and there are fresh MBBS pass out, they need a clinical exposure. So in that, they go for completely offline. There are few doctors, they need the practical and the theoretical part both. So according to that, we suggest, right? So according to their interest, they are choosing the program, blended learning or online or offline, right? But all the three options, definitely it is helping to doctors with
Okay.
their busy schedule.
Okay, but why DMHCA believe in blended learning?
Blended learning is an opportunity to the doctors, where to the practicing doctors especially, right? They are busy into their schedule. They are working in a hospital. In evening times, they are running their clinics, right? So they are not having that much of time to go for a complete offline program for 6 months or 12 months. So these blended learning programs helps the doctor to complete their online part according to their timing, according to their schedule. When they are free, they can log in and study, and they can complete it, right? It's not mandatory to log in every single day, right? So according to their schedule, they can complete online. And offline part is important because they need training, they need clinical exposure. That's the reason they are choosing, and we are providing these trainings in, as I told you, like we in our partner hospitals across globe, now you can say.
Okay, so I totally agree with you that blended learning is very convenient for doctors and for everyone.
See, actually, when you talk about blended learning program, so when you say blended learning, it includes both online and
Yeah,
offline, right?
offline.
So here, Delhi Medical Healthcare Academy's main goal is provide the guidance in their career, right? So which means when you talk about career guidance, definitely these are working professionals,
Yeah.
right? We can't ask a working doctor to come to a class offline,
Yes.
right?
True.
So the major part of the particular course, we cover the theory part in online, right? So they can study our ebooks, they can attend our recorded lectures. We also provide live interactive sessions. These three things can be done online without disturbing their daily routine, because we don't restrict them to access this particular content any particular time. So 70% we don't disturb their daily routine. The interested doctor, those who want to brush up in hands-on training as well as clinical attachment, so they can come for a shorter duration, like every day, like 5 to 6 hours, if they can spend in any particular hospital, so they can cover both online as well as clinical training part. So that's why we always believe in blended learning, which will help them.
Okay, so I'm sure doctor's course will be very difficult, but are you sure that a doctor can learn difficult concepts in like through online classes only?
See, that's what, yeah, I mentioned the same thing
Yeah.
in earlier discussion, right? So every particular, topic, definitely, first of all, you need to cover the theory part. You need to make
Yeah.
understand the other doctor. So our expert faculty designed the content in such a way. So whatever the theory part, definitely we will cover in online. But yes, if there is a doctor who would like to experience the patient in the hospital, we always ask them to come for the training in hospital itself. And here, so there are a lot of courses like medicine related and surgery related, and their super specialty. So it always depends on the course as well as the specialty as well, whether you need to choose only online to understand the subject or to choose offline. So obviously both are important. And as you said, yes, we can't cover everything online,
Yeah.
but yes, based on the requirement, if there is a doctor, let's say for example, there is a gynecology doctor, we have a course like high risk pregnancy course is there.
Mhm.
High risk pregnancy, I can't teach online, right?
Yeah.
So you have to be in the department. You need to look at the cases. You need to work under supervision to handle such high risk pregnancy cases. So in this particular scenario, I always suggest the practical
So
training.
now I'll ask fun question. Suppose DMHCA were a person, so what vibe DMHCA would have? What kind of vibe?
A person.
Yeah, if DMHCA were a person.
Person, I can say obviously a teacher vibe, because we teach, we
Yeah.
educate doctors. I can say that.
Okay, so would you like to add?
Same kind, faculty kind.
Obviously, we are into education, right?
Yeah.
So,
Okay, so in one word, if you could describe DMHCA, then what it would be? In one word.
say if you want me to say in one word, DMHCA, I can say a torchbearer, because we show the career path to doctors. I think that is a suitable word, I can say.
global guidance.
Okay, so now let's do a fun part. We have a round called rapid fire fun. So we will start with that. Okay. So
Okay.
my first question is one DMHCA course you would recommend to your younger self. If you could choose a career in healthcare only, so what would it be?
Would like to recommend internal medicine.
Okay, and you?
So you're talking about suggesting to my younger self?
Yes, yes.
If I'm a doctor and if I want to do any particular course, definitely I think I choose pediatrics because I'm interested in pediatrics.
Okay.
Because so treating children, yeah, that's
Okay.
why I can.
Internal medicine, it covers all the branches, so it would be better to get into internal medicine.
Okay, so now you will not get more than 2 seconds. Okay, from next question. So your dream hospital tie-up.
I can say IMS.
Okay. So do you have any answer? Same, aims. Okay. So which DMHCA course title sounds the most powerful?
What?
Sounds the most powerful.
Course title.
Course title?
Yes.
I think every course, every super specialty course sounds more powerful to me. But yeah, there are a lot actually, like surgery courses.
Subspecialties, super specialty courses.
For me, robotic surgeries sounds more powerful, maybe. For me, that is my personal
Head and neck
perception.
oncology,
Okay.
surgery. These are few courses which sounds more powerful.
Okay. So if you could rename DMHCA for fun, what would you call it? Rename the DMHCA just for fun.
As we are into medical education, MedPath.
MedPath. Okay, that's a nice one. So most in demand course right now.
There are few flagship courses which are in demand. It's critical care and endocrinology, and apart from that, cardiology also. And there are few courses in surgery, branch of surgery also, like robotic surgery, which is in demand. And few gynec courses are there, fetal medicine. There are so many courses which are in demand.
Okay, so that's all. I had asked all the questions to you I had. So thank you so much for joining us today. So yeah.
Thank you for having us today.
Okay. It's a wrap on today's episode of Mentor Talks by DMHCA. Big thanks to Nikhil and Moin for sharing their stories, insight, and straight up advice. If you are an MBBS doctor looking to grow in your career, head up to over our website dmhca.in, explore our programs, and take your career to the next level.